Today, we're tackling a question that could literally change millions of lives. Is type 2 diabetes actually reversible? The conventional wisdom has always been no, but the science? Well, it might just tell a very different story.
To really get a sense of what's at stake here, let's start with a number, 500 million. That is a massive number. It's the estimated number of people around the world living with type 2 diabetes right now. This isn't just a health issue, it's a full-blown global crisis. And honestly, it's only getting bigger.
And look, we're not talking about some minor inconvenience here. At its heart, type 2 diabetes is so frightening because of how it just silently, systematically attacks the body from the inside out.
What's truly terrifying is how sneaky it is. It quietly goes after the body's tiny blood vessels, which leads to this just devastating chain reaction of complications. We're talking heart disease, kidney failure, blindness, even the loss of limbs. And the scariest part, this damage can go on for years before you even know something's wrong. So you'd think, given how serious this is, that our standard treatments would be aimed at stopping it in its tracks, right? Well, that brings us to what our source material calls the conventional treatment fallacy. For most patients, the journey is depressingly predictable. It kicks off with a diagnosis and your first medication. Then, after a few years, a second drug usually gets added to the mix. Eventually, you start insulin injections. And as your body gets more and more resistant, those insulin doses just keep going up and up and up. And here's the part that's just so hard to wrap your head around. Even while patients are on this ever-increasing cocktail of treatments, the real damage to their blood vessels, their kidneys, their eyes, their heart, it just keeps getting worse at the same pace. The drugs are managing a number, the blood sugar, but they're not stopping the disease itself.
This really gets to the heart of the argument here. I mean, if a person is just facing a lifetime of more and more medication, can you really call that a treatment? A real treatment, a true cure, would be getting that person to a point where they don't need the medicine at all.
So, if the conventional way of doing things isn't the real answer, what is? Well, to figure that out, we have to dig deeper. We have to uncover the actual root cause of the problem. Let's just ask the most direct question we can. What is the actual fundamental thing that causes type 2 diabetes? It turns out the science on this is pretty clear. The immediate problem is a condition called insulin resistance. Now, what that means is that the cells in your body, in your muscles, your liver, they basically start ignoring the hormone insulin. Insulin is supposed to be the key that lets sugar from your blood into the cells for energy, but the lock isn't working anymore. Okay, but that just kicks the can down the road, right? If insulin resistance causes diabetes, then what's causing the insulin resistance in the first place?
The answer is something called lipotoxicity. It sounds complex, but the idea is actually pretty simple. It's just a buildup of excess fat inside our cells. Imagine trying to use a key in a keyhole that's been jammed full of gunk. That's what the fat is doing. It's physically blocking the cell from getting insulin's message.
So, what causes this gunk, this cellular fat to build up? This is where it all starts to sound very, very familiar. It's an unhealthy diet, the obesity that often results from it, and a lack of physical activity. These are the things that are really driving the whole disease process from the very beginning.
And right here, this is the most powerful and hopeful insight in this entire story. Do you see the pattern? Diet, weight, activity. These are all lifestyle factors. And that means they are factors that are within our power to change.
And that realization just changes everything. It opens up this incredible, entirely new possibility. Not just managing the disease, but actually reversing it. So what does that path to reversal even look like? The approach is a total lifestyle program. It means really strict changes to your diet, using things like intermittent fasting, and, of course, regular exercise. But the single most important piece of the puzzle, according to our source, is that last one, patient education. Real, lasting success comes from understanding why you're making these changes. That's the game changer.
Now, what's so amazing about this is that when you start to address the root cause, the benefits go way beyond just getting your blood sugar numbers in line.
Remember how we said that at its core, diabetes is a disease of the blood vessels? Well, when you take away that toxic environment of high blood sugar and excess fat inside the cells, you give those damaged blood vessels a chance to finally heal and recover. And that healing creates this incredible positive ripple effect throughout your entire body.
Blood circulation starts to improve. That recovering vascular system means a huge reduction in heart-related problems. You see, you're not just managing a number anymore, you're actually restoring health to the entire system.
So, we end in a completely different place. The evidence really suggests that for so many people, type 2 diabetes isn't a life sentence. It's not a one-way street. And it leaves us with this one really powerful thought. If the cause of this disease is our lifestyle, could the cure be found there as well?